Hi, welcome to another episode of Talking with Docs. I'm Dr. Brad Weenie.
And I'm Dr. Paul Zalzal.
And I'm Dr. Nicole Callan.
Dr. Callan, thank you so much for joining us.
For coming back.
I know. I love it when you come back on the show because you're so smart. You explain everything so I can just stand here and I don't really have to say anything. Just watch and learn.
So today's episode, we're answering some viewer comments. We had a very popular video on hemorrhoids that was done about a year ago, and a lot of our female viewers have said, hemorrhoids and pregnancy, it's making me crazy. Can you please talk just a little bit about this topic? So we brought in the expert to nail it down.
We actually read the comments and respond.
We do, every single one. Okay, so what's the story with hemorrhoids in pregnancy?
So hemorrhoids in pregnancy, obviously, hemorrhoids are for everyone.
Okay.
But there are certain things about pregnancy that are going to increase your risk of getting hemorrhoids.
Okay.
So if you've had hemorrhoids prior to pregnancy, you're most certainly going to get hemorrhoids during your pregnancy.
And just to clarify, what is a hemorrhoid?
Okay, so just kind of make it simple.
Yep.
Hemorrhoids are like veins. They're blood vessels.
Okay.
So you know how you can get like varicose veins
Yes.
and you're like you can see big juicy veins even in your body. Well, there are many veins in your anal canal.
Okay.
Okay, here's an image. We'll just pop up an image, a schematic, not a real image.
Yeah,
of a hemorrhoid.
like the hemorrhoidal plexus, we call it.
The plexus.
Yeah. And so obviously there is blood in these veins, and
Right.
blood has to get back to your heart,
Yep.
right? Mm-hmm. So pregnancy, what about pregnancy makes those hemorrhoids not come back up? Well, or I shouldn't say not come back up, because when we get a hemorrhoid, it's because the blood isn't flowing out of these veins.
Right, so something's stopping it.
Something's stopping it. Well, so what's the first and most obvious thing that could
Your
be stopping
baby.
it? Exactly, right? So you got this baby, you got a lot of pelvic pressure,
Yeah.
it's heavy. So obviously there's a physical, mechanical, inability of blood to easily flow back.
So when you look at that beautiful miracle after you've had a baby, say, you are why I have a hemorrhoid.
Pretty much.
Yeah, so in the chat says, why is my name Hemorrhoid?
Hemi.
Hemi. Hemi for short.
So, then there's the hormonal changes of pregnancy that happen.
Okay.
So when we're pregnant, we produce progesterone.
Okay.
So what does progesterone do? Well, it relaxes everything in your body. Understandably, we want the baby to grow. We want muscles to be relaxed so there's space. So what does that do to those veins? Makes
Dilates
them relax, dilates them. So therefore, you have another reason for flow for the hemorrhoids to accumulate, because now you have a dilated vein that doesn't contract as well.
And then so after the pregnancy's over though, and your progesterone levels go back to normal, does the vein have some irreversible damage that can't kind of shrink back?
It probably reverses to some degree,
Right.
but
So they get better,
there
but
might
they don't
be,
go away.
it might not go completely 100% back
Okay.
to normal.
Okay.
But now you've had hemorrhoids.
Because
You
like
never
your
had
stomach, right? You know, in pregnancy you stretch.
Yeah.
Well, your stomach's never going to be tiny again.
That's right. Sorry, stomach.
It comes close,
Yes.
we like to think.
So what kind of symptoms are people that have hemorrhoids during pregnancy? Because maybe someone that hasn't ever had a hemorrhoid and they're like, I'm pregnant, there's something kind of going on down there, I'm not sure. What kind of symptoms are they going to have?
Well, it's going to be the same as your
Okay, which
regular.
are?
So itching, burning. Well, it depends on the hemorrhoid. No, I think we talked about that before, but internal versus external. So internal hemorrhoids are painless but will bleed. External hemorrhoids, usually they'll stretch that outside skin, which is what gives you that pain, itchiness, burning. It's the swelling that really causes the issue.
Okay.
If the internal hemorrhoid pops out and gets stuck, then that can give you pain too. But
Right.
Okay.
So those would be those.
So do we
sort of-
approach these differently than in the absence of pregnancy hemorrhoids?
I would say we want to be more cautious because
Okay.
we don't want to do anything that's going to trigger premature labor.
Okay.
So the first thing is going to be conservative management.
Right.
Okay.
So same sort of things we talked about before, like the high fiber. So the other thing with progesterone, it's going to slow down your bowels. Everything is slow, right?
Okay.
So you're going to tend to be more constipated during pregnancy. Most people will be taking vitamins which have iron in them, which
Yep.
are also going to slow things down. So you want to make sure you're getting lots of fiber, lots of water, and that you're moving.
Fiber, water, moving.
Yeah,
Got
activity is key.
If
right?
you're drinking a lot of fiber and water, then you are moving.
Moving to the bathroom.
Yeah. Yeah.
Okay.
Then the other thing you want to be doing is not gaining excessive amounts of weights, because
Okay.
that's going to also kind of aggravate things. So-
Right, so an appropriate amount of weight, and this is something to discuss with your family doctor. There's a wide range of the amount of weight that you gain during pregnancy. Make sure it's a healthy amount.
Yeah.
It's not a free-for-all.
Yeah. Yeah.
Okay? Number 3? What about local treatments, like things we've talked a little bit about, sitz baths and hygiene
so you can do,
issues?
Actually, most important is no sitting and straining on the toilet. So sometimes you'll get, I can't remember if we talked about this before, but
a little bit.
Yeah, we touched on it.
I think this is the number one reason that hemorrhoids are just not getting better is, I think people get a lot of swelling in that region.
Sure.
And it's uncomfortable. And so it gives the brain the perception, I need to go to the bathroom. And so people will go and sit there and try and push it out. But there's nothing to push out, there's no stool, it's just the swelling. So I think the one key piece I always tell people is, one, if you go to the washroom and nothing comes out, get up and move. Don't stay there, because you can imagine if you're staying there, you're sitting on the toilet. The toilet is designed to like spread your butt cheeks apart.
Right.
So what is that going to do? It's going to make those hemorrhoids kind of fill up with blood.
Right.
So if you're sitting there, they're just filling, and there's going to be less return. So they're actually getting aggravated by sitting on the toilet.
Good.
Go or get off the pot.
Go or get off the pot. And I always say, like, if you want to hide from your family, you can hide in the bathroom.
Yeah.
But put the seat down.
There you
and then
go.
grab your iPad, your book, whatever. Right.
Let's get locked
Just
the door.
don't sit there with the buttocks distracted.
Got it. Okay. Wow, that's a lot. You know what? It sounds like there's a pile of factors that lead to hemorrhoids in pregnancy.
Yes, well, so those piles, they will never go away. They're like scar tissue for your hemorrhoids. We forgot about pushing with labor.
Ooh, right, okay.
Yeah.
So like think about the mechanical force of passing a baby. Right. Could you imagine that?
No, as men we're not allowed to.
I don't dare to, and I don't dare to think I can even understand that.
Thanks, women, for being willing to deliver babies, because men, there'd be no babies.
We don't.
We are babies.
I have nothing to say in that department.
So there's a lot of pressure going down there. So that's obviously going to be a huge trigger for hemorrhoids, right?
Okay.
And
then there's no way to avoid that, though, right? I mean, unfortunately, you got to get. Okay, but you're not going to have a C-section to avoid hemorrhoids.
Well,
you don't ask for it, because you're not going to get it.
Yeah. Just saying, there are. If you do have a C-section.
But I mean, if you have to push, you have to push.
You have to push, yeah. And most people it's probably a safer thing to be pushing, I think.
Right.
Minus for your hemorrhoids.
Right. Okay.
But you're going to get those hemorrhoids that develop, they get swollen, you get the tags, the piles, and they're not going to go away unless you surgically cut them out. But, nobody's ever going to have a baby's bum. Like, your baby's bum is when you're a baby. Right. So I figure with time, you get scar tissue around your bum, hemorrhoid tags. If they don't bug you, you just leave them alone. There's nothing. It's like cosmetic surgery for the bum. Right?
That's right.
And in the rare cases where you do need treatment, you would just, if you needed surgical treatment, you just wait till the baby was delivered. That's the safest time, obviously. You're not going to ever have hemorrhoid surgery unless it was an active bleed that had to be stopped. That would be the only time to ever have surgery for hemorrhoids during pregnancy.
So we still have to go back into, like, let's say you're presenting with symptoms. If it's obvious hemorrhoids, okay, that's good. You need to see your physician to make sure that it is a diagnosis of hemorrhoids, because there can be other things that develop in pregnancy, inflammatory bowel disease. So you have to make sure that's officially your diagnosis if you're having bleeding, or even if there is a lump there, who knows? It could be a tumor, it could be. So you need to make sure you see someone about it to confirm the diagnosis. And then it's really medical management. So, the things we talked about, the conservative measures. We don't want to do surgery because we don't want to trigger any preterm labor. You want to minimize any kind of inflammation in the pelvic region.
Great summary. So hemorrhoids in pregnancy, a lot of factors lead to it. The mechanical pressure of the baby and the altered vasculature, the progesterone that's dilating the vessels and slowing your bowels. And the treatment, we would like to go conservative as possible, because we don't want to interfere with the pregnancy.
So that would be like our fiber, our Tux pads. There's some more fiber sources out there that have come out that are like
new fiber
really
sources.
Cool. Yeah, I don't. They're like a red fishy jelly bean, and they have like so much fiber in them, and they're great.
Okay, red fishy jelly beans.
Smart something.
Yeah. Got it. Kinda. Okay. Don't mix them up with your gummies.
Don't. Yeah.
Right. Okay.
I guess some people would benefit from gummies with fiber.
Fiber gummies.
That's the thing. If you like this video, please like it, subscribe to our channel, and best of luck with your pregnancy and with your hemorrhoids. And share this video with anyone who you know who is pregnant and looks like they may have hemorrhoids. Remember, you are in charge of your own health. And thanks to Dr. Callan for joining us again. We'll see you next time.